Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter M. Today I'm not going to talk about any specific diseases, but in general, the maternal care. I had a previous video probably involved in some topics here, and also I'm sure if you are pregnant, you probably already follow your obstetricians or your family physician regularly for each trimester, what kind of tests you need to do in terms of the genetic screening, or also particularly for those older women, beyond age of 35 years old, if you have this carry this exciting new life with you, and I'm sure your obstetrician or your family physician already told you what you're supposed to know. But why I have this video, just to think about this as a reminder. In addition to compliance with your physicians, regular follow-up, and to check the baby and check yourself. And this is a reminder on top of that, particularly mention about some diseases associated with this pregnancy, for example, gestational diabetes or hypertension or preeclampsia. So this is about talk about this maternal care. Let me just bring up the emergency situation. Any emergency situation, you need to see the emergency right away associated with your pregnancy, maternal care. Of course, you know it. I'm sure your physician already told you what are signs to look for to see the physician, like bleeding or abdominal pain, cramping, or any signs such as nausea, severely nausea, vomiting, particularly beyond the first trimester, so that it probably indicating something going on. Actually, the preeclampsia, for example, is the symptom, nausea, vomiting. So that's any of those kind of signs you need to see emergency room as soon as possible. In terms of the my video here, just to remind you about the some risk factors or some diseases may associate with this pregnancy, the maternal care. So I start from for all the young female without pregnancy, or have the planning, or have not the family planning, or planning to have a child or not. But I recommend you start to take the folic acid, which is really, it won't harm you, but it will have a great benefit in case you accidentally had this experience or have a baby. So that's from this part. Of course, on top of that, multiple vitamins is always going to be helpful. And in terms of the pregnant, you already know you're pregnant, and of course you have received a lot of congratulations, and also I'm here to congratulate you. At the same time, I remind you to maintain first of all, the body weight. In a lot of culture, thinks pregnant woman, the more you eat, the better for you and the baby. It could be sometimes because you imagine there's a new life growing. You have a weight is too much, then, or you gain too much weight. Some of them put in you, some of them put into the baby. If the oversized fetus also has the risk later on for diabetes or hyperlipidemia, and also for yourself if you overweighted too much. I'm not saying you have to follow exactly the range, but if your weight is beyond the standard weight during each trimester, then probably impose the risk of the obesity, and also of course the gestational diabetes. So this is in terms in general. In terms talk about these conditions of diabetes and hypertension during the pregnancy. If you had hypertension before, then I'm sure your physician already told you, discussed the management plan. If you don't, and you develop the blood pressure elevation beyond the normal range, then the preeclampsia with the symptoms, not just hypertension itself, but also other lab tests or headaches or nausea, vomiting, etc. Physician has the criteria to diagnose whether you have or not having preeclampsia. But like I said, either of these, the hypertension or diabetes, tend to occur during a stress situation or overeat, put too much body weight for you and for infant. In terms of how to diagnose, I'm sure you already have the glucose challenge test during your second trimester, and your physician will tell you whether you have it or not have it. In terms of the blood pressure, I'm sure how to lower to maintain normal blood pressure. In other words, how to prevent preeclampsia happening. I think it's the genetics one cause. The risk factors for these two conditions are you have previous. If during your previous pregnancy you had a preeclampsia or eclampsia, increase the risk. Or if your previous pregnancy you have diabetes, also at the same time, increase the risk for the next pregnancy. So this is the first of the risk factors. Others, other than that, depends on the lifestyle and also the medication and like I said, the genetics from your family. If your family member had this kind of condition, you have the increased risk. So how to prevent? I think start from the beginning, the planning. If you're planning, if you think you're at the age of childbearing age, and you're planning to have a child, so start from the beginning, healthy lifestyle, keep in mind the focus on exercise, eating healthy, lower the level of stress, and before you're really determined to have a child. And also taking the nutrient supplement, it won't hurt you. I recommend young female take the multiple vitamins and on top of that folic acid. It won't hurt, but like I said, the benefit of protection, just in case, it's greater than you can imagine. And also, if you, after the pregnancy, and you follow your physician's guideline and follow compliance with the regular visit to make sure you, yourself, and also the fetus is normal health growth, and also follow those tests. In terms of the immunization, I'm sure there's some immunization requirement before the pregnancy. That's probably the best. For example, the rubella, immunize before you have the child or have fetus, or before you decide to have a family, a child. And if not, if you already find out you are pregnant, but you did not have that titer of the antibody, your physician will tell you what to do in terms of to prevent the damage to the fetus. So these are the general topic for young female, and I'm sure you probably know it either through your self-knowledge or through your physician, but I'm just here to remind you important serious conditions like gestational diabetes or hypertension called preeclampsia, and also in terms of nutrition, how to start early to be prepared and to make yourself ready for yourself and for the fetus. So I'm going to stop here, and I hope it helps. And thank you for watching. I will see you next time.